The lie about the prostate and the hidden myths surrounding male anatomy have created a silent epidemic of anxiety among men, particularly those entering their middle and senior years. Dr. Emily Carter, a specialist physician with decades of experience in urological health and male wellness, and I have seen firsthand how these insecurities can erode a man's confidence and his relationship. Many of my patients come to me with a heavy heart, convinced that they are somehow falling short of a standard that they see on their screens or hear about in locker rooms, but the truth is often far more reassuring than they imagine. Around 95% of men who worry about the size of their penis are actually within the medically normal range. This suggests that for the vast majority, we are not dealing with a physical issue, but rather a distorted body image. This distortion is fueled by unrealistic comparisons to adult films or digitally altered bodies where exaggerated proportions are often shown. As we embark on this essential journey of discovery today, I want to help you clear away the misinformation and replace it with scientific certainty, because understanding your body is the first step toward regaining your mastery and peace of mind. It is fascinating to observe that this concern is far more prevalent among men than it is among their partners. While about 55% of men report feeling anxious or dissatisfied regarding their size, only 5 to 10% of women say they consider it a very important factor in a partner. This disconnect tells us that we are often our own harshest critics, projecting an internal insecurity onto an external world that is not actually judging us by the same metrics. For middle-aged and elderly men, these feelings can be compounded by the natural physiological changes that come with aging, making it even more important to ground ourselves in clinical facts. My goal is to educate you and put your mind at ease by sharing real scientific data and explaining exactly how to navigate these concerns with dignity and health at the forefront. The rise in male genital cosmetic procedures in recent years is a direct reflection of this growing curiosity and anxiety, and it is a topic that has moved from the shadows into mainstream medical discussions. However, before anyone considers a surgical or chemical intervention, they must first understand the baseline of their own anatomy through accurate measurement. Most men who feel inadequate are actually perfectly normal, yet they continue to live under a cloud of doubt because they have never been taught how to assess themselves correctly using the same methods that urologists and researchers use in clinical trials. We must acknowledge that our perception is often skewed by the angle from which we view ourselves, which is usually from above, a perspective that naturally makes things look smaller than they would appearing in a mirror or to a partner. In the sections that follow, we are going to dive deep into the specific protocols for measurement, the global averages that define our species, and the very real risks associated with trying to change what nature has provided. We will also discuss how conditions like weight gain or changes in skin elasticity can hide your true length, creating a false sense of shrinkage as you age. It is time to stop guessing and start knowing. By the end of this discussion, you will have a clear, evidence-based understanding of where you stand and why your worth as a man has never been measured in inches or centimeters alone. This is about more than just numbers. It is about reclaiming your sexual health and your self-esteem through the power of truth and professional guidance. We will begin this exploration by looking at the most consistent and clinically reliable methods for measuring your anatomy, ensuring that when you do look at the numbers, they are numbers you can actually trust. When we move into the actual practice of measurement, it is vital to understand that accuracy is the only way to combat the anxiety born from guesswork. Many men attempt to measure themselves in a casual or haphazard manner, which often leads to inaccurate results and unnecessary stress. As a physician, I always emphasize that the most consistent and clinically reliable method used in scientific research is the flaccid stretched length, which closely correlates with erect length. To perform this correctly at home, you should use a ruler or a measuring tape. The process begins at the pubic bone, which is the point where the penis meets the body. This is a crucial detail because many men have a layer of fat in the lower abdominal area, especially as they reach their 50s and 60s. If you simply place the ruler against the skin, you are not getting an accurate reading of your internal anatomy. You must gently but firmly press the ruler into the fat pad until you reach the bone. Once the base of the ruler is securely positioned against the pubic bone, the next step involves the actual measurement of the shaft. While in a flaccid state, you should stretch the penis out firmly but not forcefully and measure to the tip of the glans or the head. It is important to note that the measurement ends at the tip of the glans itself. The same process applies when erect. You must start at the pubic bone and measure to the tip, keeping the ruler on top and aligned with the shaft. A common mistake I see is men trying to measure from the skin surface or from underneath, but these methods are discouraged because they add extra length or lead to inaccurate numbers. By following this standardized medical protocol, you are ensuring that your data is comparable to the large-scale studies that define what is considered normal. This consistency is what allows us to separate clinical reality from the distorted perceptions often found in popular media. For middle-aged men, this method is particularly empowering because it accounts for changes in body composition. If you have gained a bit of weight around the midsection over the years, your visible length may have decreased, but your actual anatomical length from the bone remains the same. Understanding this distinction can immediately alleviate the fear of shrinkage that many men report during their annual checkups. It is also worth noting that environmental factors can influence your state of relaxation, so it is best to perform these measurements in a warm, private environment where you are comfortable. Cold temperatures or stress can cause the tissues to contract, which might interfere with getting a proper stretch. Remember, the goal here is not to find the largest possible number but to find the most accurate one. When you have an accurate measurement based on the bone-to-tip method, you can finally move away from the locker room comparisons and toward a healthy science-based understanding of your body. This foundational step is essential because it sets the stage for our next discussion, which involves the often overlooked but equally important dimension of girth. While length often gets the most attention in public discourse, the circumference or thickness of the shaft plays a significant role in both physical sensation and the geometric reality of your anatomy. As we move forward, we will apply this same level of clinical precision to understanding how to measure thickness and why those numbers are so meaningful for your sexual health. While length often dominates the conversation surrounding male anatomy, as a physician I can tell you that girth or circumference is just as significant for both physical sensation and psychological confidence. In my clinical experience, many men who express dissatisfaction with their bodies are actually focusing on the wrong dimension. Girth refers to the circumference or thickness of the shaft, and it is a measurement that can vary significantly between individuals. To measure this accurately, you must move away from rigid rulers and instead use a soft measuring tape or even a piece of string. If you use a piece of string, you can then lay it flat against a ruler to determine the value. While you can measure both flaccid and erect for comparison in most scientific studies, erect girth is the standard measurement. The proper technique for measuring girth involves wrapping the soft tape or string around the midshaft of the penis. You want to avoid placing the tape too close to the base or too close to the tip. It is essential that the tape is snug against the skin but not so tight that it compresses the underlying tissue, as this would provide an artificially low reading. Once you have wrapped the tape around the midpoint, record the number where the ends meet. This gives you the circumference of your anatomy. For many of my patients, seeing this number provides a different kind of reassurance. Mathematically, girth contributes significantly to the overall volume of the organ, and in the context of intimacy, the pressure felt by a partner is often more closely related to circumference than to how deep the organ reaches. It is very common for men to overestimate or underestimate their size because they use poor measurement methods or they compare their flaccid state to someone else's erect state. This creates unrealistic expectations. For middle-aged and older men, maintaining the quality of an erection is the primary factor in maintaining girth. As we age, changes in blood flow can sometimes lead to a slight loss of fullness, which might be perceived as a loss of girth. This is why I always tell my patients that the best way to protect your measurements is to protect your cardiovascular health. The same mechanisms that keep your heart healthy are responsible for filling the chambers with blood to reach full potential circumference. Furthermore, understanding the relationship between length and girth helps in deconstructing the perfect image often projected by the media. Most men are not perfectly symmetrical or consistent with the exaggerated figures seen in entertainment. Some may have more length while others have more girth, and both are entirely normal variations of the human form. By taking an accurate girth measurement, you are completing the anatomical map of your body. This data allows you to look at your health objectively rather than through the lens of insecurity. In the next section, we will take these numbers you have gathered and compare them to the largest scientific datasets ever compiled so you can see exactly where you fit in the global average. You might be surprised to find that what you once thought was small is actually right in the middle of the healthy, normal range for men worldwide. Now that we have established the correct medical protocols for measuring both length and girth, it is time to look at what the science actually says about the results. One of the most significant hurdles for men in their middle and senior years is the lack of a realistic baseline, often replaced by exaggerated myths. To address this, we look to a large-scale meta-analysis conducted with data from nearly 15,000 men worldwide. This kind of study combines data from many different research papers to produce reliable averages. When measured erect or flaccid and stretched, about 90 to 95% of men fall within a specific range. That range is between 10 and 16 centimeters, which is roughly 4 to 6.3 inches. The global average length is around 13.2 centimeters, or just over 5 inches. If your measurements fall anywhere within that range, you are completely and medically normal. It is important to understand that the extremes of the spectrum are statistical outliers and represent only a tiny fraction of the population. In clinical urology, we have specific definitions for these outliers. A micropenis is defined as having an erect or stretched length of less than 7.5 centimeters, or about 3 inches. On the opposite end, a macropenis, which is very rare, is usually considered above 24 centimeters, or over 9.5 inches. For the vast majority of men who feel anxious, the reality is that you are likely sitting right in the middle of that 5-inch average, which is exactly where nature intended the majority of the species to be. When we shift our focus to average girth or circumference, the data is equally revealing and should serve to further ease your mind. The majority of men fall into a typical range for thickness as well. For a flaccid stretched girth, the range is between 8 and 10.5 centimeters, or 3.1 to 4.1 inches, with an average of about 9.5 centimeters. When we look at erect girth, the range is between 10 and 13 centimeters, or about 3.9 to 5.1 inches. The average erect girth is approximately 11.5 centimeters, or about 4.5 inches. These are the real numbers scientists refer to when they talk about being average. The disconnect between these scientific averages and public perception is largely due to the influence of unrealistic standards, especially those seen in adult films where actors are specifically selected for unusual size. Even then, camera angles and editing exaggerate the perception of their anatomy. For my patients in their 50s and 60s, I emphasize that being within these ranges is the anatomical norm for the human male. The takeaway from this data is simple: if you are within these scientific ranges, you are in the vast majority. Furthermore, even if you fall outside the curve, it is essential to remember that these numbers do not define your health, your desirability, or your masculinity. A measurement is simply a data point, not a verdict on your worth or your ability to enjoy a fulfilling sexual life. As we move into the next section, we will explore why these numbers might seem to change as we age and how you can manage the physical factors that affect your visible anatomy. We will look at how lifestyle choices and physiological shifts in the middle years can create the illusion of loss and what you can do to maintain your anatomical integrity over time. As we progress through middle age and into our later years, many men begin to notice what they perceive as a loss of size, a phenomenon that can cause significant emotional distress. I want to clarify right now that in the vast majority of cases, the internal anatomical structure of the penis does not actually shrink. Instead, what we are often observing are external changes in the body that create a powerful optical illusion. One of the most common factors is the accumulation of weight in the lower abdominal area, specifically in the fat pad around the base of the penis. As men age, metabolism slows down and fat often settles right at the pubic bone. This fat can essentially hide a portion of the shaft, making less of it visible even though the measurement from the pubic bone remains the same. This is why the measurement technique I described earlier, where you must press into that fat pad to reach the bone, is so critical for older men to get an accurate reading. Another physiological shift involves changes in the skin and connective tissues. As we age, our skin loses some of its natural elasticity, which can change how the anatomy appears in a flaccid state. Furthermore, the quality of blood flow is the engine behind both length and girth. As the cardiovascular system ages, conditions can lead to changes in stamina or firmness, which many men misinterpret as permanent shrinkage. It is important to realize that this is often a functional issue related to blood flow and desire rather than a loss of tissue. This is frequently manageable through healthy habits and medical guidance. I often tell my patients that the best thing they can do for their sexual health in their 60s is to take care of their systemic health. Scientific focus has turned toward supporting arousal, blood flow, and staying power through natural means. There is a 100% natural approach that has been helping tens of thousands of men feel confident again by restoring firmness and drive without relying on risky gimmicks. This works by supporting the natural triggers for blood flow, which are essential for reaching full anatomical potential. By improving your internal health, you are essentially ensuring that your body can perform at its maximum capacity. We must also touch upon the fact that many men who feel frustrated or embarrassed about their performance are definitely not alone. Understanding that your hidden length is often just behind a few pounds of weight or a minor blood flow issue can be incredibly liberating. It shifts the focus from a permanent loss to a manageable health goal. As we move into the next section, we are going to look at the interventions some men seek to change their size. We will examine the world of cosmetic procedures, distinguishing between those that offer temporary improvements and those that carry dangerous risks that every man must be aware of before making a decision. As we navigate the complexities of male sexual health in our later years, it is entirely normal to feel curious about the medical interventions available to enhance your anatomy. However, as a physician, my primary responsibility is to help you separate the marketing hype from medical facts, ensuring you understand the significant risks involved. One of the most common cosmetic requests today involves girth enhancement or increasing thickness. A frequently discussed method involves injecting hyaluronic acid. This is a substance naturally found in the body and is used in facial fillers as well. When injected along the shaft, it can temporarily increase girth by 2 to 3 centimeters. However, the effect only lasts around 12 to 18 months as it is absorbed by the body over time. While hyaluronic acid is considered safer, many other substances offered are incredibly dangerous. Some clinics offer non-absorbable fillers such as PMMA or even industrial-grade silicone. These can cause severe complications including chronic inflammation, hard lumps or nodules, deformation, and irreversible damage to tissues. For these reasons, these substances are not recommended by reputable medical organizations. When it comes to procedures specifically designed to increase length, the options are even more limited and carry higher risks. There are two primary procedures sometimes offered for lengthening. The first is liposuction of the pubic area, which removes fat around the base to make more of the shaft visible. While this improves appearance, it does not actually increase anatomical length. The second is suspensory ligament release, a surgical procedure that cuts the ligament holding the penis to the pubic bone. This can add 2 to 2.5 centimeters of visible length when flaccid, but it does not increase erect length. Furthermore, it may cause instability during intercourse and carries risks of complications and scar tissue. It is vital for men to understand that there are no permanent approved methods for true penile lengthening endorsed by most international medical bodies. I also want to clarify a common misconception regarding penile implants. These are medical devices used in the treatment of erectile dysfunction and are only recommended in specific clinical cases. They are not meant for size enhancement. Seeking these procedures often stems from psychological pressures, but the physical price can be high. Before considering any intervention, it is essential to ask yourself if the risk of permanent damage is worth a temporary or visual change. For my patients struggling with performance or perceived size, I often suggest looking towards supporting the body's internal mechanisms. Rather than jumping to surgery, focusing on supporting arousal and blood flow through natural techniques can often restore the firmness and strength that men feel they have lost. The goal of any medical journey should be health and function first. As we move into our next section, we will explore the historical and partner-based perspectives on this topic, which might help you realize that the pressure you feel to change your body is a relatively modern and often unnecessary burden. To truly move beyond the anxiety of the modern age, it helps to look at how our perceptions of masculinity and anatomy have shifted throughout human history. We often assume that the obsession with larger size is a timeless human trait, but historical evidence suggests otherwise. In ancient Greek culture, the ideal male body was actually portrayed with a smaller penis. To the Greeks, this was seen as a sign of wisdom, self-control, and rationality. In contrast, large penises were often associated with barbarism, lack of discipline, or even comedic exaggeration. If you look at the masterworks of antiquity, such as the sculptures of great gods and philosophers, you won't see oversized anatomy. When large penises did appear in art, they were often part of caricatures or depictions of mythological figures like Priapus, who was a fertility god portrayed as grotesquely exaggerated. This historical perspective is crucial because it shows us that cultural ideas about masculinity and size change over time. What is considered ideal in one era can be the opposite in another. This means a significant portion of the anxiety men feel today is based more on social influence than on any objective biological truth. For men in their middle and senior years, realizing that the standard has been moving for centuries can be an incredible relief. You are not fighting against nature. You are fighting against a temporary cultural trend that prioritizes aesthetic exaggeration over functional health. Furthermore, we must address the perspective of our partners, as this is where the most meaningful reassurance often lies. Scientific surveys consistently show a disparity between what men worry about and what their partners actually value. While about 55% of men report feeling anxious or dissatisfied about their size, only 5 to 10% of women say they consider it a very important factor in a partner. Most partners report that factors such as emotional connection, respect, and overall health are far more critical for sexual satisfaction than physical dimensions. In the context of a long-term relationship, the quality of intimacy is driven by communication and being present with one another. As we mature, our understanding of masculinity should evolve from a focus on physical metrics to a focus on character, strength, and health. The anxiety that stems from comparing oneself to unrealistic standards online is a thief of joy. By grounding yourself in the knowledge that your body is well within the normal range of biological data, you can stop being your own harshest critic. True masculinity is not defined by size, but by the confidence you carry and the way you treat those you love. In our final section, we will bring all of these threads together to talk about how you can proactively manage your health and embrace the coming years with a sense of mastery and peace. In this final stage of our journey together, I want to emphasize that the path to true sexual confidence as you age is not found in a surgeon's office, but through the proactive management of your health and the alignment of your mindset with scientific reality. For my patients who have spent years feeling frustrated or embarrassed, I often begin by reminding them that they are definitely not alone. We have seen that roughly 95% of men who worry about their size are actually within the medically normal range. This means that the majority of your power lies in restoring your body's natural efficiency, particularly by supporting the molecule that triggers blood flow and staying power. By focusing on your systemic health, you are directly supporting the quality of your firmness, which is the most effective way to ensure you reach your full anatomical potential. Restoring your confidence also requires a deliberate shift away from the distorted images found in media. Those unrealistic standards are nothing more than a social influence that ignores biological truth. Instead, look at the evidence. The global average erect length is approximately 13.2 centimeters, and the vast majority of men fall within the 10 to 16 centimeters range. If you fall within these bounds, you are completely normal. Even more importantly, remember that your partner likely places very little weight on these specific numbers, valuing respect and your overall health far more than physical dimensions. As we age, our worth is defined by our wisdom, our self-control, and the strength of our character. By embracing these truths, you can release the heavy burden of anxiety. Taking charge of your health today is the most masculine act you can perform. Whether it is through staying active to maintain your blood flow or simply accepting your body with the respect it deserves, you are choosing a path of dignity. If you found this content helpful, please do not forget to like the video, subscribe to the channel, and turn on notifications so you do not miss more science-based, judgment-free content that helps you thrive. Your questions are always welcome as we strive to build a community of informed and confident men. Thank you so much for your trust and for taking the time to invest in your own health. As we bring this intense scientific journey back to a moment of deep reflection, remember that you are the primary steward of your own well-being. Do not let social myths dictate your happiness or your sense of self. Empower yourself with these facts, take proactive steps toward a healthier lifestyle, and walk forward with the confidence of a man who truly knows himself.